Welcome to We Hear Her. I'm Erin Trenbeth Murray, and I'm here today with another amazing woman who is sharing her story and insights into life lessons learned. Hi, I'm Erin Trenbeth Murray with the We Hear Her podcast for women who succeed. Today, I get to speak with Lisa Nichols, and we're going to be discussing the role of nonprofits in healthcare, both the challenges and the opportunities. Many of you may know that healthcare is complicated, diverse, but even more so when it's a nonprofit entity serving a vast community. We're going to dive into Lisa's extensive experience in the nonprofit healthcare world, discuss the challenges faced by being in that space, and addressing health disparities within the community. We're also going to explore the impact of strategic philanthropy in supporting healthcare initiatives. But first, let me tell you a little bit about Lisa. First of all, just learned she's a Murray Spartan, which I love so much. Lisa has more than 30 years of experience in nonprofit healthcare, emphasizing and addressing disparities and ensuring access for underrepresented communities. As the Vice President of Community Health for Intermountain Health, Lisa leads the community health portfolio, including Intermountain's community health needs assessments. She works to address social determinants of health and health disparities through community-based collaborations and strategic philanthropy. Lisa supports Intermountain Health's initiatives to serve as an anchor institution, ensuring that organization deploys its assets to address Intermountain's mission of helping people live the healthiest lives possible through local hiring, local sourcing, impact investing, and sustainability. Lisa has served as an adjunct faculty at Westminster College and the University of Utah, teaching nonprofit health services administration courses. And Lisa earned a Master's of Social Work degree from the University of Utah. Welcome, Lisa.
Thank you, Erin. It's great to be here.
I'm so happy to have you here. I learned so much, and so much was running through my head about the complexity of both the strategic philanthropic giving, understanding the community assessment inside and out, and looking at strengths and disparities within the community, and I would assume where those assets are assigned.
Right.
What's your favorite part of working in a nonprofit healthcare system?
Well, I really love the mission of Intermountain Health. It's helping people live the healthiest lives possible. And that mission is about keeping people well in our communities. It's actually about keeping people out of our facilities because we want them to be well. And we also recognize all of the really complex factors that influence health, right? I mean, only a small portion of it is being able to see a physician. It's also where you live and whether or not you're safe and whether or not you know where your next meal is coming from and you have stable housing. All of those things influence health. And I'm really proud that Intermountain recognizes that and tries to keep people well.
I'm so proud of that as a Utah resident and someone, my background for about 25 years was serving families in poverty, people in poverty. And I was explaining the ACEs study to a group yesterday. And so what you just described it's really true and core, I think, to Intermountain Health.
Yeah, absolutely. And Intermountain Health has primary children's here in the community. And we try to touch and understand every child, because if we understand that trauma that happened early in their lives or other things they've experienced, we can change the entire trajectory of that kid's life. And in Utah, where we serve 50% of the community, if we're changing the lives of kids, we're changing the lives of our entire state.
The entire state.
Yeah.
Intermountain is massive, and it's in a good way. Like it's in every community. It's access to healthcare to the nth degree. But I would assume that with the strengths of being able to draw the most qualified physicians and have the top-notch facilities and have outreach and depth, that it must be challenging from the nonprofit healthcare perspective. What's it like to work in such a well-oiled machine that is actually a nonprofit healthcare system?
I'll go back to what I said earlier. It's a well-oiled machine. We try to make healthcare as simple as we can, as accessible as we can, And we really listen to our communities. So we're, as part of our community health needs assessment, we're out in every community, we're listening to people, and we're making services that are really responsive. And to the extent we are well-oiled, it's because we listen. It's because we have a continuous improvement mindset. We're always trying to learn, we're humble, we want to understand where we could do better, and we want to incorporate community voice. So we're always focusing on that, and I'm really proud of it.
What do you think the challenges are of being a nonprofit healthcare?
Yeah, well, I think, there are challenges in every healthcare system. There are challenges around workforce and supply chain. And I actually think the opportunities of nonprofit healthcare are bigger than the challenges, right? We use all of our assets to improve the health of our communities, right? So when we look at purchasing, just as an example, right, we know that having stable employment is connected to health. So to the extent that we can purchase locally, to the extent we can purchase from our diverse and multicultural communities, we're improving health. So I know your question was about challenges, but
No, let's go strengths
there
then.
is so much opportunity to think about every decision and how it influences health and well-being.
No, I'm glad you're being strengths-based and jump to that. So let's talk for a little bit about your community initiatives.
Yeah.
Tell me about what really moves you when you're trying to make decisions or you see wins,
Yeah.
something that you know your fingerprints were left on. What is that? What is that experience like for you?
Yeah, what I most love is the collaboration across the community, right? We know, again, that health is influenced by so many things apart from the healthcare delivery system. So that means if we're going to keep people well, we have to work in collaboration with other community partners. So I'm really excited. I'll just give a couple of examples. We invest in affordable housing and have invested in about 2,000 units. And that's a part of our investment portfolio that's used as flexible capital, kind of like a traditional loan. But for those 2,000 families that have been housed, right, that's significant in terms of them being able to follow their education and being able to follow their work in stable relationships. We can't do that by ourselves. We're not housing experts, but we do it alongside developers and traditional lenders and nonprofit organizations that are trying to surround these families and keep them well. In our hospitals, we screen every patient. We ask every patient, do you know where your next meal's coming from? Are your utilities turned on? So we ask questions like that keep people well. And then we can use that data and we can collaborate with community-based organizations to make sure we're meeting those things that people are experiencing that are interfering with their ability to be well.
I love that when you said at the beginning, you said, we're really trying to keep people out of the hospital and that very holistic approach. You mentioned being safe earlier in the interview, and then you just gave several really strong examples of maintaining that well-being. I think that folks such as myself who have employment and good insurance and transportation to get to the doctor whenever I need to. I have a flexible schedule pretty much, so I can pick and choose when I want to go to the doctor. I have access easily to my computer or my phone to pull up a variety of providers if I'm looking for a specific type. And then I can afford to pay the copay or pay, the portions that I need for my
Yeah.
prescriptions. Very different healthcare experience than some populations that really have things stacked against them. I love that you're working with the community partners to try to break those barriers down.
Yeah, we take a lot for granted. I take a lot for granted, but it's complex. Even sort of making a medical appointment, and maybe you don't speak English, right? And we do our best to meet everyone exactly where they are to be able to provide services in their language, but it's confusing, and maybe healthcare is structured differently from where you came from, and so yeah, we try. We're very mindful about understanding those things, about meeting people where they are, and ensuring that everyone has high quality, affordable care.
Yeah. So many years ago, I was on Intermountain Healthcare's, Intermountain Health, but it was Intermountain Healthcare at the time, advisory board. and which our purpose and a lot of discussion was centered around disenfranchised populations and populations that were struggling financially to pay with needed financial assistance. Can you speak to that a little bit about Intermountain's Health's approach to serving those populations?
Yeah, so Intermountain provides health care to anyone, regardless of ability to pay. We have really robust financial assistance programs, and those are extended to individuals who come in our doors. But we also collaborate with a lot of community partners, the free clinics, the federally qualified health centers, to ensure that if there's a service that they need someone to have, but they can't provide it, that there's really a warm handoff with us and that people feel comfortable understanding that we're going to work with them on payment.
I didn't know that. I didn't know the community.
Yeah.
That's cool.
Yeah, we've got like
That's really
60
cool.
plus community-based organizations that we work with to ensure that continuum of care.
Wow. Where do you see Intermountain Health in 5 years? Just in the kind of a short term. That's not very long for such a big organization. But where do you see some of the initiatives or the innovation that are maybe your top 2 or 3 things that you expect to see with Intermountain Health?
Yeah, change takes a lot of time. But 5 years ago, I spent a lot of my time having conversations with people that housing is health and food is medicine. And that is really widely accepted now. And where I see us in 5 years in terms of really keeping people well is in that preventive, proactive space where we're understanding the drivers of health. We're addressing alongside community partners the conditions in which people live. And we really are delivering on that mission of helping people live the healthiest lives possible.
Love that. Maybe does that tie at all to the change in brand a little bit? Tell me a little. When I heard a little bit of an explanation, I want to hear it from you about the some branding changes, and it was impressive to me. Tell me a little bit about that.
Thank you. Yeah, I love our brand and our name. So as you mentioned earlier, we've moved from Intermountain Healthcare to Intermountain Health. And that really is a strong recognition that health is more than healthcare delivery. It's more than just going to the physician. We want you to go to your medical provider when you're sick. We want you to go to your medical provider when you're well, but you want to get your immunizations and your well child checks. But we also want to support you in being active and being safe and having the right nutrition. So I love how all-encompassing and comprehensive our mission or our name is in the brand change.
I like when the explanation part of that was even better than I heard. But a small section that I also heard was, our name is recognizable. We don't have an awareness issue. But we want people to also understand a much more human side to us. The holistic perspective you just described, I think, does that.
Yeah.
That it's beyond just kind of a cold black and white medical, facility of the 1950s.
Right.
Like, this is way more than that.
Thank you for saying that. We want to be partners in health, right? We want to be alongside you and your family in being well and in creating healthy communities.
What community would you say is the most remote that you're in?
It's the most remote that we're in. Oh, goodness. We're in a lot of rural communities in Utah. We're in Garfield.
Oh, yeah.
Which is very much a rural community and a tourist community. And we collaborate with the hospital there through a management services agreement. We have a number of nonprofit hospitals across the state of Utah and even outside of the state of Utah and Montana and Colorado. And one of the things I'm really proud of is that our nonprofit hospitals are stable and thriving, and that's difficult in this environment. We've seen 161 nonprofit hospitals close across the United States.
Wow. Well, and the reason why I threw that curveball at you a little bit.
My geography isn't really good.
It's okay. It was good. You said Garfield. I think what I was curious about was I'm envisioning how cool your job is, first of all. And I was thinking how neat it is to individualize that in your role the strategic side of you gets to think about the health needs of somebody in Garfield compared to the health needs of somebody in Murray, Utah.
Yeah.
And they're different, and there's different resources, and there's different communities and
Yeah.
values.
Yeah. Yeah, they are different. And in fact, we've been on a little bit of a listening tour in some of our rural hospitals. We went to Burley, Idaho, and we went to Garfield, Utah, and we hear the same things in different ways. So in our rural communities, we hear access. Access is a challenge. It's a challenge for specialty care. You might have to drive hours for specialty care. We hear about behavioral health. We hear about behavioral health
Sure.
everywhere we are, that people are struggling with depression, that unfortunately across our communities we have high rates of suicide. And we hear that there are concerns with affordable housing, right? So we actually hear the same things, but the solutions are maybe different, right? So you might be looking at telehealth access.
I was just going to say
in a
that.
rural
Yeah,
community,
yeah.
and we actually have a virtual hospital where we have specialists that can connect to our rural communities and other communities that might need a specialist. It's really, sometimes rural communities don't have as many nonprofit resources. So how can
Right.
you work with those existing nonprofits to really leverage what they have, to understand the gaps? But they're also just amazing strengths because people know one another and have a lot of pride in the community and a lot of knowledge of the community. So sometimes they can come together in ways that are easier and stronger than a large community like Salt Lake, where there's so many
For
people
sure.
and organizations. It's
just different.
So it's just different, and it's listening to each community. It's understanding the needs, it's understanding the assets, and working alongside those communities.
I think that's the beauty of listening to you. It's not a one size fits all. It's not a cut and paste. There's some
No.
basic elements and threads, themes.
Yeah.
But my husband grew up in a really tiny rural Utah town, and it's really interesting because the primary physician is also on the water board, who
Right.
is also his neighbor that he sells hay to, and they are
Right.
and so they are all. It's a level of trust. There's a very strong level of trust in those communities because they know one another.
Right.
But certainly, we all have our strengths in our communities, and it's neat that you get to tailor
Yeah.
a little bit more to what they need.
Right. And we really want a strength-based approach because
Right.
every community has really significant strengths.
Well, you have a fun job. I
Yeah.
like to say I have the best job in the world. You're pretty close.
Yeah,
That's
mine's
really
pretty
cool.
good.
That's a really cool job. Well, Lisa,
you.
thank you for being with me today and sharing with everyone about Intermountain Health and the amazing things that you're doing and you're going to get to do.
Yeah. Thank you, Erin, for the time and the opportunity.
My
I
pleasure.
appreciate it.
So we are concluding with Lisa Nichols, the role of nonprofits in healthcare. I'm going to say just opportunities, because Lisa was able to share with us the variety of ways that Intermountain Health is able to touch lives throughout the state of Utah and beyond, to individualize for those communities, to look at a holistic approach to health. And we're just grateful that they're here for us and have such a stellar, amazing reputation right here in our own backyard. So with that, thank you for being here with the We Hear Her podcast, and I look forward to seeing you next time. Thank you for taking the time to hear her. Join our efforts and learn more about Women Who Succeed at womenwhosucceed.org.